Hello and welcome again to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Now, bad breath is a common problem that can affect anyone at any age. It is a noticeably unpleasant odor on exhaled breath. About 1 in 4 people are thought to have bad breath, also called halitosis, on a regular basis. Bad breath statistics from the Breath Institute say that between 35 and 45% of people in the world have some level of halitosis, but everyone suffers from it at some point in their lives and at some time of the day. Bad breath sufferers are 60% more likely to suffer from stress than non-sufferers. My guest on the show is Dr. Olutola Eweka. Dr. Eweka is a consultant oral physician at the Lagos University Teaching Hospital and the College of Medicine, University of Lagos. You're welcome to the show, Doctor.
Thank you very much.
Okay,
nice.
Bad breath. Not a good concept. What causes it?
Okay, there have been several causes. You have the intraoral causes, that the causes within the mouth, and then of course the causes that is outside the mouth, which will be in the body generally.
Okay.
So the one for within the mouth is usually caused by poor oral hygiene. That's where there's plaque, those white accumulations in the mouth. That is basically bacteria which resides in the mouth normally. So this bacteria would break down the proteins and the food debris in the mouth and give off this gas, it's called, that comes out as bad breath.
Okay.
So that's basically it.
So the culprit in this case is the food?
Is the bacteria.
Well, it acts on the food. If the food was not there,
then the bacteria will have nothing to act on.
And there will be no bad breath.
That is the...
Aha, okay. So other causes?
Other causes, you could look at caries in the mouth. You have a hole, food will lodge in there, bacteria acts on that.
Okay.
Then you could have gum disease, where there's bleeding in the mouth, it becomes occult, that's stale, and then it gives off this breath.
Oh, that's the meaning of occult, stale.
Stale,
occult
yes.
blood, okay.
Yes. So that could also be. Then you could have other things, food like garlic, onions, and people that like to eat it for
that is direct.
Uses.
Nothing has to act on that one.
No, direct. In fact, that is broken down in the blood and giving off, the chemicals is giving off in the breath as bad breath. Then diabetes, when it's not controlled, could give us ketotic breath. Then we have several others.
Does that mean acids coming from within the body out to, through the mouth? I mean, in the case of diabetes.
Well, yes, that's for the ketotic breath.
Okay.
Yes, because the ketones are high, so it's giving off in the breath. The chemical is giving off in the breath as a ketotic, as a specific kind of breath for diabetic patients. The renal disease, GIT, patients with constipation, diarrhea, indigestion, all these gases come from the stomach and comes out as bad breath. So we can have all that.
Now, usually people don't know they have bad breath. So how does a person actually find out there's bad breath?
Okay, from my experience with most of the patients we do have, many of them do not know. 90% of patients don't know they have the breath, because when you give out your breath, it's like smoking. The gas goes out to other people. Then this person, it doesn't come back. So the person really hardly smells it. But usually people would tell people that are concerned, maybe a close relative or a close friend in the office or a close colleague can say, look, my friend, there's this odor, you have to take care of it. But most people that have bad breath do not know that they have it.
Now, if you're looking at the picture on the screen, that part of the tongue, is that the culprit? Is that where most of this bad breath comes from?
Yes. Now, the tongue is furry, is hairy, and usually because we don't brush the back of the tongue, you can have the bacteria staying there in that slimy environment, very conducive.
Wonderful for growth.
You don't brush, you don't touch that.
Yes.
Then the bacteria begin to give off the bad breath and all that. So tongue coating is a major cause of bad breath.
But that part of the tongue is so difficult to get to. It's very sensitive. Once the brush gets there, lots of people feel like they want to throw up, and so they just withdraw.
Yes.
But we'll come to that. Perhaps later on you will tell us a method by which they can get to that place, a lot easier than people do now. Okay, and is it true that some types of medicine make the breath give up,
That's true.
come up foul.
There are a lot of drugs that will cause dry mouth, like we have antidepressants. It causes dry mouth. When the mouth is dry, there's no saliva to help to cleanse the mouth. That's one. Then other drugs that have its own smell will be given up in the breath of the patients. So a lot of drugs do cause that.
Okay, you said something really interesting now, saliva. Tell us what really is the work of saliva in the mouth.
Okay, saliva has different functions. One, it helps with buffering the mouth. That means where there are acids, it helps to bring the basic component of it and helps to neutralize it.
Okay.
Then apart from that, it helps to wash the mouth, cleanse the mouth. If you notice, if you are eating and your mouth is dry, the food doesn't go down properly, compared to some people now have to drink water to allow the food to go down. So it helps in cleansing. So if you produce enough saliva, you'll be able to wash off either swallowing or spit out whatever debris is in the mouth. So the component of saliva is very important. Then we have the saliva itself has some components that helps to prevent infection. So if there's a problem with the saliva, then infection is allowed to grow in the mouth, and that could cause a lot of pain and then a lot of bad breath and all that in the mouth.
So in the case of bad breath, saliva is actually the friend, not the enemy.
No, definitely yes. Saliva is the friend. We need saliva to be able to help to cleanse the mouth regularly.
Okay, for those who are unfortunate enough to have bad breath from medication, okay, let me give this scenario. If somebody has diarrhea,
okay,
they tell you you're losing electrolytes, so they give you zinc and some other things, probiotics, sort of to restore the atmosphere of the gut. Yes. Is there such a thing for the mouth?
For the mouth, we have some medications that can help as saliva substitutes.
Okay.
That you can give the patients that have xerostomia, that's dry mouth for other medical reasons. We give saliva substitutes to help to restore. It helps to moisturize the mouth, just do the same work the saliva is doing.
And that would help with the odor.
It will help. The same thing will help with the odor. The same thing with chewing gums. There are some gums that do not have sugar. The patients can take it and then chew on these gums. It helps to produce more saliva, which therefore helps in the cleansing of the mouth.
Okay, I'm hearing something here. People like